depending on what the protocol is. Or you're allergic to aspirin. If they tell you yes, what do? Okay, this is your next question.
What's your reaction to it?
What kind of allergy do you have to it? If they tell you, well, my stomach gets a little irritated, no big deal. The risk benefit, every medication, every procedure you do, oxygen, whatever it is, has risk benefit. Okay? The risk is what? A little bit of an irritated stomach, no big deal. Okay? What's the benefit? It may help slow down the heart attack, right? So in that case, you give it. Unless they tell you, I swell up like a blowfish and I can't breathe. Then you know that's an anaphylactic reaction. You do not give it, then you give something else like Plavix, for example. Some services go directly to Plavix, depending on what your protocol is and what medications you guys have there. Okay. The morphine. What does the morphine do? It's an anxiolytic and analgesic, and it cools the blood. So what's an anxiolytic? Anxio, anxiety, and lytic means to lyse or to cut.
Right.
So it helps with the anxiety. Somebody that has a heart attack or chest pain sometimes has a feeling of impending doom. I'm gonna die. So what does that happen? If their pain was a 5, now they're working themselves up, now they're breathing 60 times a minute, and everything's just going, straight. So you want to try to calm them down, say, listen, I know you're having chest pain, but we're gonna help you. We'll give you some medication that's gonna help you. Okay? Always giving them positive words. Listen, this pill that I'm gonna give you, are you taking any kind of sexually enhancing drugs? If they say no, ask them again and tell them how serious it is, because, for example, if it's a male, the wife might be there and, he's taking it for somewhere else, or she doesn't know about it. You understand? So he might be embarrassed. Sometimes you might have to question them by yourself. Say, listen, man, let's get this medication. It can be really bad if you're taking it. Please tell me the truth, and I won't give it. If you do give it, always say, listen, this is going to help relieve your chest pain. It's going to make you feel better. Right away, the positive endorphins get released in your brain, and those have a pain relieving effect. Okay?
And
just like a placebo, exactly. Why do placebos work? Because people believe they're going to work. You understand? So always give them something positive. When you give them a medication, and never, ever negative statements around the patient or around the family. Okay? Even if a patient's unconscious, they say the last thing to go is the hearing. Many patients have awakened and said, hey, I heard what you guys said, and you're like, whoa, wait a second, I thought you were almost dead. You understand? So always positive. Hey, we can help this guy, we're gonna save him, come on, let's work hard, we can save him. Always positive.
So what if he lies to you about the medication and you give him that?
You document, patient stated, negative use of you document it on your report. Okay? You're gonna have witnesses. Other nurses, the doctors, family, somebody, the witness. Okay? And remember, when you give a medication, especially IV, you can't take it out. So if I'm gonna give a medication, say I'm gonna give morphine 10 milligrams, okay? Or 2 milligrams, or 4 milligrams, or 3, whatever your protocol is, okay? So we're gonna give morphine, 2 milligrams. Hey, listen, do me a favor, can you confirm? Okay, morphine, sulfate, IV, 2 milligrams, yes, that's correct. Always echo it back, okay? If a doctor gives you an order, let's say the doctor gives you an order, or your supervisor, wherever, tells you, hey, give this patient atropine, 1 milligram. Well, atropine speeds up the heart. It's for bradycardic heart rhythm. Certain bradycardic heart rhythm. Not all of them, exactly, not all of them. For example, it's not for third degree, for high degree block, second degree, type 2 or third degree.
What does that mean?
You'll get into it in EKG, and I'll explain to you better, and they'll explain it there, I'm sure. But you say, okay, just confirm. You want me to give 1 milligram of atropine, 1 milligram of atropine, IV push, correct? There's nothing wrong with confirming it. Because if you give it and you know that it's wrong, you're just as fault as the person that gave you the order. And guess what? Unless it's recorded or somebody else witnessed it, that doctor, whoever's gonna say, no, I told him to give, I didn't tell him to give atropine. I would never hear it. Pulse rate was 150. Why would you give atropine to 150? You're gonna blow their heart up. You understand? So always echo it or parrot it. Like a parrot repeats things. always parrot back the order. Okay? Confirm, we're gonna give da 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 da. Alright? And don't be afraid to say, doc, are you sure you want to give atropine 1 milligram to this patient who's having a sinus tachycardia at 150? And then he'll say, oh, wait a second, did I say that? Sometimes they say things, even us, we say things and we don't realize, you might go, oh no, you meant this and this, your mom did earlier. They say things and they don't realize, oh, you said this and this, oh, okay, well, I meant this and this. And me as a doctor or as your supervisor would want you to correct me. When I was a lieutenant risk, I would tell the guys, hey man, if you see me messing up, don't let me mess up. Call me out on it, I won't get offended. Trust me, we've got to do what's right for the patient.
Jesus, you got that all the way.
Hmm?
She keeps going back and forth. Yeah, she does it all the time.
Alright, you're probably
So we left off on pain reading. After the pain reading, I would collect information by looking at the patient.
Have they taught you the OPQRST yet?
OPQRST?
Right.
Like the EG?
Onset, provocation, quality, radiation, region, severity, and time. So usually in a patient with mostly any kind of pain, but like chest pain, you want onset, or you don't want to start, or what time to start, more or less. Provocation, what caused you to have the pain? I was riding my bike and I had pain. Palliation, did anything relieve it? Yeah, when I sat down, it relieved. So sometimes angina pectoris, which is a type of chest pain, relieves with rest. Okay. Then quality. Tell me about the quality. Is it a crushing pain? Is it a stabbing pain?
Yeah.
Is it a heavy pain? What is it like? Sasha. Radiation. Does it move anywhere? Your jaw, your back, your left arm mostly. It could be both arms. Okay. Region. Epigastric, left. Okay, right. Severity, 0 to 10. Tell me your pain 0 to 10. Some places say 1 to 10. All right. And it's always the worst pain you've ever felt. Now, remember, pain is relative.
Subjective,
Okay? But it's relative to the person, which means, what does that mean?
same thing.
You might walk around with your arm at a 90-degree angle and arteries spurting out and 2 bones sticking out, and I might break a nail and faint. To me, this pain was a 10 and maybe faint. You might say, this is a 3, no big deal. Okay, so that's relative. But it's relative to that patient. So if the patient tells you a 9, it might not be a 9 for you, but it's a 9 for them. Your goal is to bring it down to 0 or to a tolerable level. How's your pain now? You know what, it's a little bit, but not that bad. I can take it,
Okay. So I would look at your hygiene, or your overall hygiene if you look like a hobo. I would look for any abnormality. This is like in the beginning when I first meet. Look for anything
That's
unusual.
double inspection.
What?
You're inspecting right now.
Yeah. And then your posture.
Well, it's important that if I'm sitting in a tripod position, I may be having shortness of breath. Okay? Look for short, choppy breaths with 2 or 3 word sentences. I can't do a full sentence. That's a sign of respiratory distress. Obviously, neck muscles, intercostal muscles. And like I said, you can tell, breathing is a passive event. In other words, from across the room, you shouldn't be able to tell that I'm breathing. You might have to get real close. If you could tell from across the room, I'm in some kind of distress, or I was exercising, or I'm extremely excited about something.
Okay. Now with the assessment, first thing I'm going to do is inspect your head. I'm going to look at the pink color of your skin, of your head, the size of your head relative to the size of your body.
They're both big.
There's any twitching, and if it's symmetrical, your head, which it looks to be all good. Then I would ask you to close. Then I'm gonna test cranial nerve 7. I would ask you to close your eyes tightly and open.
Would you like to examine my head?
If you wanted to.
Well, it's part of your assessment, right?
Yeah.
Why don't you do it?
Well, first I'm inspecting, so I'm looking.
Okay.
I'm not touching anything.
Okay.
Okay. Now to test it, I'm gonna ask you close your eyes, open, smile, frown, and puff out your cheeks. Okay. Now I would palpate your head. So I would grab gloves and I feel for masses. So let me feel for masses on your head. Nope.
Okay, you gotta feel the back too, feel the neck and everything. Back
Okay.
here. Make sure the back here is separate.
Infestations and alopecia, and there's neither. Okay, next, the trigeminal nerve. I would palpate your temporal artery here. Now I'm going to test your cranial nerve 5, the trigeminal nerve. Okay, so I'm going to feel your macerator muscle. Slide down hard. Okay. The TMJ, go ahead. Okay. Open your mouth against resistance. And then I would palpate your maxillary sinus. Motherfucker.
What's your language, son? Sorry. He doesn't normally speak that way to his patients.
Maxillary sinus and your front.
Good job, Sasha. Way to protect me. You thought he was gonna poke my eyes out, huh?
Okay. Inspect eyes. White sclera, which your sclera is white. Okay. Your pupils are round and they're equal, and they are a 3. I'm gonna check your conjunctiva. They're both pink. Next.
And if you're out in the sunlight and you can't turn the sun off, like here you turn the lights off, just make sure you cover and then check.
Now I'm gonna test the 3 cranial nerves that are in your eyes.
Sasha.
The 3 cranial nerves that are in your eyes, which is 3, 4, and 6. Oculomotor, trochlear, and obtuseness. Those 3. So I'm gonna hold the pen light 12 inches away from you. I'm gonna move 6 ways, and you follow the pen light with your eyes. Ready? Come on, man. Your eyes, don't move your head. Sorry. Don't move your head, bro. Okay, follow it to your nose. Nice.
Let's turn off the lights. Where you going?
You wanna see what you? It's not too dark. Is that the general? Ready?
I'm ready to try this. No, you step. I'm pointing right there. You step right in.
I was gonna step.
Okay.
I actually stepped on it?
Yes, you did. That's right. I think it's water.
Okay, ready? Stare off to the wall there. So your pupils are equal, round, reactive to light, and they accommodate. Lights back on. Yeah, this stuff.
Step on the bed right here.
You gotta step on more.
Yeah.
Come on, man. I have to